Friendly Neighborhood Child Psychiatrist will help you in determining if a child's symptoms warrant medications. And I would say, if it's at the point that it's causing enough distress in your child's life that you're considering reaching out to a higher level of care, then medications, may be warranted. And so we look at, again, the range of symptomatology, and for moderate to severe anxiety, that's where we would consider, usually in conjunction with talk therapy, prescribing a medication. The most common classes of medications that are used to treat anxiety disorders are antidepressants, anti-anxiety medications, and beta blockers. And the most common gold standard treatment within the antidepressants are selective serotonin reuptake inhibitors, commonly known by the acronym SSRIs. And so how do they work? From a neurochemistry standpoint, they influence the brain chemicals that regulate emotion and thought patterns. As child psychiatrists, we're always assessing for safety, tolerability, and effectiveness. And this is a dialogue we have with patients at each clinic visit. The good news is treatment for anxiety is highly effective. So we should see results happen usually over the course of 1 to 6 weeks, depending on the medication. And you'll know that your child is feeling better because oftentimes they'll be able to share with you in voice that they're feeling less anxious. You'll see other domains of life that were impacted begin to improve. So things like their academics often start becoming more manageable again. They're re-engaging in relationships that they may have stepped away from. Hanging out in the family spaces more often, and they're looking better, brighter, less overwhelmed and worried. So kind of the initial reasons that you brought them in, those symptoms begin to decrease.
For updated information on our mental health programming, subscribe to our YouTube channel, like our Facebook page, follow us on Instagram, or find us at catchescommunity.org. Catch is dedicated to making a difference in our community through empowering families to raise resilient and independent